This is Dr. Rajeev Jain. I'm an orthopedic surgeon working at Jodhpur, Rajasthan. That's the place in India. I'm going to tell something about chronic disorders like osteoarthritis and rheumatoid arthritis. So these are chronic diseases which lead to a lot of problems for the patient, problems in terms of medical as well as non-medical. The more important things are non-medical problems like these lead to depression, these lead to fatigue of the patient, muscle weakness, and lot of other symptoms. So we are going to discuss how physical activity or exercises are going to be helpful in these type of diseases and how can we help these patients by physical exercises. So physical activities are very helpful to relieve the pain in osteoarthritis and flare up of the rheumatoid arthritis. As you know, osteoarthritis and rheumatoid arthritis are chronic disorders of joint, and these usually occur at old ages. And once these occur, they remain with you almost throughout the life. So we need to prolong the onset of the disease, and we need to see that the disease severity does not go to that level that it requires the surgery. So let us discuss about the physical activities which help in relieving the pain in osteoarthritis and rheumatoid arthritis. So physical activity and exercises, they are growing popularly and they are recommended worldwide by several authors and physicians and medical practitioners for effective management of different type of chronic diseases. In addition to severe discomfort, chronic pain also induces various medical conditions like fatigue, anxiety, depression, and hence a poor quality of life. So painful conditions like rheumatoid and osteoarthritis may cause immune system complications, making individual more susceptible to various other infections and clinical manifestations. Regular exercises and daily physical activity, these are the best way to tackle these type of chronic disorder. As the adverse outcome, as it increases the energy level, these exercises help to increase the energy level. They help to boost the immune system and also improve the emotional well-being of the patient. So moderate and regular physical activity also help to keep the joint and muscles in motion and help in muscle building. These are important in cases of rheumatoid arthritis patient who suffer from severe decrease in mobility and stiffness of the joint. So it's like a vicious circle. The osteoarthritis or rheumatoid arthritis, they tend, the patients of these disorders, they tend to avoid the physical activity. So once you start avoiding the physical activity because of the pain, this leads to decrease in the muscle strength. And this decrease in the muscle strength and the stability of the joint these are important risk factors for the progress of the disease. So what we need to do, we need to do physical exercises the and some physiotherapy for the relief of the pain of osteoarthritis and rheumatoid arthritis. So the best treatment plan is based on doctor's recommendation, including requisite lifestyle measures and necessary medical support. Exercise and physical activity, as suggested by doctors, can help to reduce the pain, inflammation, and swelling. So suitable exercise program has to be made for individual patients, and this has to be customized or individualized. What type of exercises to do, what is the intensity in which the exercise has to be done, what is the time for which the exercise needs to be done, and the frequency for which the exercise has to be done. So a specialized exercise program has to be made by a doctor and physiotherapist, which has to be individualized. So the quality of the life improves once the symptoms of the pain decreases. Once the quality of life improves, the fatigue, muscle strength also increases, and the depression of the patient comes down. So these type of diseases do not progress at that rate at which it should progress if a person does regular physical exercises. Moreover, these regular physical exercises in normal people, if it is done, the onset of the disease and the progress of the disease slows down. Once the disease starts, apart from these physical exercises, which is the mainstay or the cornerstone of the treatment of this type of disease, we need to give patients some types of medicines. The most important medicines are disease modifying drugs, which are very helpful in case of rheumatoid arthritis. These drugs are of various kinds, and these help in decreasing the disease, the morbidity of the patient in these type of diseases. These disease modifying drugs also decrease the frequency with which the disease progresses. It also decreases the severity with which the disease is occurring. Apart from these disease modifying drugs, we have other drugs which are very helpful, which are known as biologics, which are very helpful in cases of rheumatoid arthritis. In osteoarthritis, we do have a set of disease modifying drugs of osteoarthritis which help in slowing the progress of the disease, in regenerating the cartilage. These are known as cartilage regenerating medicines. Moreover, we have some injections which can be given intra-articularly in the knee joint. And once the disease progresses to a stage, either stage 3 or stage 4, where nothing can be done and patient has severe pain, total knee replacement is recommended in these patients. For a healthy lifestyle and healthy living, for any type of diseases, for these type of ailments which are chronic and which is going to cause disability and decrease the activity of the patient, exercises are recommended. So in short, we should know that in most of the chronic disorder, including osteoarthritis or rheumatoid arthritis or lumbar spondylosis, which are orthopedic related, exercises are the mainstay. Increase in the muscle strength leads to increase in the blood supply around the joint, which in turn leads to increase in the cartilage regenerating capacity, decrease in the weight of the patient, which leads to decrease in the progress of the disease. So for any type of disease, any type of chronic ailments of orthopedic related, exercise is the mainstay, and the patient has to consult the physiotherapist and the doctor and come to a suitable exercise plan. And these plans are very helpful for the patients. The take home message is that all people, irrespective of the disease, whether they have the disease, osteoarthritis, rheumatoid arthritis, or not, should stick to a suitable exercise plan. This plan is helpful for them and for their life. Normally, we have seen that the female patients develop early onset osteoarthritis because of inactivity or activity only at home or sedentary lifestyle. So, the onset of osteoarthritis and the progress of osteoarthritis is more in cases of female as compared to the males. So they are the most important people who should do regular exercises so that their disease occurs at a later age or does not occur or occurs at a very low intensity. So that's all for today.